back pain, prevention, and restoration. Today on the Homepage Network, another healthful broadcast of UPMC Susquehanna. Hello everyone, I'm Sarah Vout. Parents, you may remember as a student what it felt like carrying a locker on your back. Or perhaps you're watching your own child head to school with a backpack that's half their size. Either way, it's a reason to take action. Back pain from backpacks is a common problem for students. Homepage correspondent Rhonda Pearson met with Mindy Hannawalt, a physical therapist at UPMC Susquehanna, to discuss backpack safety.
Hi, Mindy.
Hi.
Kids are getting ready to get back to school, homework, books. They're going to be lugging around a backpack. Is there a concern about how heavy a backpack should be?
Yes, for sure. And I feel like as the kids grow older, that definitely is a concern. But yes, so just the weight of them, just the size of them has gotten a little bigger. So yes, there's been some studies out there. The American Physical Therapy Association said that over 55% of kids are wearing too heavy of a backpack. Yes. Thankfully, that's not the same as having medical problems, but about a third of them do complain of some sort of either back pain or physical condition related to wearing a backpack. So that could be neck pain, low back pain, even hurting shoulders, tingling or numbness in the hands might be a sign that your backpack is too heavy. But obviously all those are concerning for kids that are wearing them. So.
Well, how can you tell if a backpack is too heavy?
Definitely picking them up. So the weight of a typical backpack. So I have 3 children at home, and so they vary in sizes. But again, you want to make sure that the backpack itself isn't too heavy. But depending on their weight, usually doctors will say between 10 and 15% of their weight is what the backpack should weigh. Okay. So that's kind of a good measure. So maybe a typical kid who's 50 pounds, you want to be checking that weight to see, okay, is it between 5 and 10 pounds, that make sure that they're not putting too much stuff in it. And also the size of it. I have a little guy who's in 1st grade, and some of the backpacks are huge, and that would not be appropriate.
They're about as tall as they are.
Yes, that would not be appropriate for him. So just lifting it up, checking it out, and then also asking them, like, are you having any back pain when you're wearing your backpack? Making sure that the load is distributed, and we'll talk about that a little bit more when we put it on. But just asking that, lifting it up, seeing when they put it on, does their posture change? Are they really loaded down? Are their shoulders really rounded? Things like that. So just kind of looking at it, but then also you lifting it also, and even going through it every once in a while to see what is still in there that needs to come out. So those are things that you can look for to see if it's too heavy for them or too bulky for them.
Well, an easy solution would be to get rid of the homework and the books. I'm sure kids would love that. But what would be more of a realistic approach?
I would say, again, just making sure what's in there is appropriate, that if they, don't have books on certain days, they don't have school, to take those out. If they feel like they need a really big binder, but maybe they don't need that, to just, again, unload it. And you can, obviously, if it is everything in there is what they need, you can talk to the teacher to see if there's something different as they age. I know a friend they get laptops usually in high school, and so that obviously then becomes a little bit more load in their backpack. So, but again, that was more electronic versions of things instead of textbooks that they're bringing home in their backpacks. But I would say homework probably going away altogether is probably not going to happen. But again, if it is a concern, speaking with a teacher, talking to your child of, do you really need this big bulky thing in there or this heavy thing in there, or can we reduce it and reduce the load for sure. So.
An ounce of prevention is worth a pound of cure. When we come back, Mindy gives a demonstration on the proper way to wear a backpack. Stay with us.
I have a different outlook on life because it could have been all taken away from me. I came home from college and my mom said I didn't look right. I just thought I had a common cold. I was diagnosed with Hodgkin's lymphoma. It was like a shock to all of us. UPMC took excellent care of me and got me to where I am today. And I'm here, 3 years in remission. I didn't choose to have cancer, but I did choose UPMC.
Welcome back, and thank you for supporting our homepage family of advertisers. Mindy, before we left for break, you mentioned that weight of a backpack is one issue, but not wearing your backpack properly could also be an issue. Would you please explain?
Yes, so as the kids are growing, obviously their bodies are changing, especially if they've been through a growth spurt. That could definitely affect their strength and their back and their shoulders. So if they're not wearing it correctly, it doesn't matter how much weight is in it, it could really cause them some problems. So I'm going to demonstrate to you how to properly wear a backpack. So this is a pretty typical backpack that an average kid would wear at school. So, okay, Rhonda, so we're going to put it on, so both hands go around. So again, both straps are the important part, and making sure it's snug to you. So we don't want it hanging over the shoulders, you want it nice and snug there. And so we're just going to pull the straps here to get that sit a little bit better. And then if you want to turn around, Rhonda, so again, this is kind of hanging low for her, so I would want it up here, so the load is going to her shoulders and not here. So we're going to keep snugging those straps. That's good. We also talk about padded straps, so that's pretty important. We don't want the weight of the nylon to be right on their shoulders. That could cause some of that tingling in the arms, so a good padded strap directly over the shoulders. And if we're going to turn this way a little bit, so you can see this backpack has multiple compartments. So again, we don't want all of the heavy weight being here, which is going to pull on her shoulders. So make sure that you're opening it, putting the heaviest items closest to her. If your teen has a laptop, something like that, there's a nice sleeve in there, that's where that would go. Any heavy books go in that one, and then anything lighter can kind of go as we come out. Obviously, water bottle there possibly, but again, try to keep that load evenly distributed so it's not pulling on them. And then just making sure that it's, again, the right size for her torso and the right width for her shoulders. You can turn it around again, Rhonda, thank you. Important part, again, we talked about the weight of that, so the percentage, less than 15% of your kid's weight should be the weight of your backpack, so take time to calculate that.
If a child is experiencing back pain and a parent thinks it's related to a backpack, what should they do?
I would say definitely you can take a break from that backpack wearing for a little bit if time allows. If they can carry a couple things to school for a couple days and really see if it's really the backpack that's related. And obviously if it's persisting, then talk to the child's doctor about that. Make sure that there's nothing structurally going on in their spine and other structures in their back. And then obviously we're here, physical therapists, any sort of rehab professionals can give you tips, and we would meet with the child, kind of look at their form specifically and kind of look at their body structure and come up with a treatment plan to hopefully strengthen their back. But yes, unfortunately, backpacks are a needed thing in school, so just letting them be as strong as they can and comfortable as they can wearing them will hopefully prevent the pain.
Well, Mindy, thank you so much for being here today. I have learned a lot, especially for my 11-year-old who is about to go to middle school, and I just bought supplies, and that was heavy enough. So I can only imagine with the books what it's going to be like. So thank you so much.
You're welcome.
If your child is showing signs of back pain or strain, speak to your primary care provider or pediatrician. For more information on backpack safety, visit upmcsusquehanna.org. Thanks for joining us today on the Homepage Network.
Being a dad with young kids, it's a very busy life, sports and games and piano lessons. When I was first diagnosed with an acoustic neuroma, I had two options: invasive brain surgery or radiation therapy. The potential risks of brain surgery are very, very scary. Severe vertigo, loss of balance, facial paralysis. I was told by at least 4 different doctors here in Southern California, you're absolutely going to lose hearing in your right ear, so just plan on it. I wasn't willing to go down that path. That led me to Dr. Lunsford at UPMC.
Years ago, after surgical removal of these tumors, many patients paid a price. Early in my training, I said there has to be another way. The Gamma knife allows us to have enormous precision designed to inactivate the growth of the tumor.
I'm just so grateful to have my health and my hearing. I didn't choose to have an acoustic neuroma, but I did choose UPMC.